Greetings, everyone. This is Judge Slackman. I will be covering the topic here of healing ADHD. That's the acronym for Attention Deficit Hyperactivity Disorder. Effective treatment solutions based upon a holistic understanding of symptoms and causes. The subject of ADHD is one that has provoked a lot of controversy over the years. There are different viewpoints and perspectives about it, different ideas about diagnosing it, about treating it. And in this particular presentation, I'll be taking a holistic approach, which kind of looks at multiple levels of how a person is influenced and how they're functioning, and seeing what will really get to the root or the causal level of addressing these issues. So to really do that, we have to have a deeper understanding of what's actually fostering any particular symptom. ADD and ADHD are psychiatric diagnoses. Those are used to describe symptom patterns of behavior that would typically begin in childhood. In recent years, more attention has been given to what's labeled as adult ADHD. However, even in those cases, it's theorized that that person's ADHD pattern began in childhood and it just continued on into adulthood, and it wasn't actually diagnosed until later on. Attention deficit disorder with or without hyperactivity is a label given to the individual, while the symptoms are actually how that individual is responding to or coping with his or her internal and external stresses and environments. In psychiatry, a label is given to a person, but of course that person exists in different environments and different contexts. So part of what's being identified in the person actually relates to the greater social reality that that individual is a part of. So we're looking at the whole system and how that may play a role with things. We're not solely looking at the individual here. To really understand things on a deeper level, we want to look more at the emotional meaning of the symptoms of the behaviors that people are displaying. One pioneer in this particular field is psychologist Michael J. Lincoln. In his reference book, Problematic Patterns, he describes causal pathways for different particular patterns or behaviors. His book is a very thick hardcover book. It's kind of like the DSM, but from a more holistic perspective. So it has an alphabetical list of different types of patterns, and it goes into a detailed explanation of what might be at the root of those patterns. From these descriptions that Lincoln provides, we can recognize that the individual person's sole agenda and their innate temperament and tendencies interact with the social environment to foster the observed, quote, disorder, which is a meaningful coping strategy rather than just a biologically dependent disturbance. Biological factors such as diet, nutrition, and drugs can influence how the pattern is expressed, yet the root causes are primarily psychological. There are three major pathways or explanations that Dr. Lincoln offers for the ADHD and ADD types of behaviors and symptoms. The first one he labels cope ability anxiety. In this scenario, they have intense feelings of being severely pressured. They're therefore engaged in frantic manic efforts to distract themselves and or the environment away from the felt enormous demands to do the impossible. It comes from being in a household in which there is too much going on for them to handle, and in which they are expected to do more than they are equipped to carry out. Essentially, they're in a stressful environment, and their way of dealing with that stress or pressure is to engage in these types of hyperactive or disengaging, in other words, withdrawing their attention from what other people want their attention to be on and engaging in some other pursuit. So these are their ways of coping. They're in some way trying to escape from that pressure. Another possibility is they're systematically given the experience that they don't have what it takes to make it. So they're kind of taught or told that they don't have the capabilities, the skills, the intelligence to be successful. So in a sense, why bother? And in that case, they may just want to engage in some stimulating, enjoyable activity that isn't stressful for them, something that can occupy their attention and take their mind away from the things that are stressful, the things that they've been taught that they won't succeed with. Another possibility is they fall into the overwhelmed reaction, and then they are regarded as having a broken brain. And this is sometimes what happens when they're subjected to the mental health treatment system. Their teachers, their parents, their doctors are telling them, oh, you have this disorder, and we have to do special things and give you special medicines to treat this disorder you have. Now, any or all of these particular scenarios could be present, could be contributing to the situation. Another potential pattern or pathway toward this pattern is what Dr. Lincoln calls the Superbeing Misfit. They are an advanced guard, quotes, person who is focused on etheric and spiritual patterns and phenomena. They are also bringing in love consciousness to the world at large. They're an intuitive and empathic clairsentient who is a kinesthetic and tactile learner. They don't learn well from visual or auditory inputs alone. They need to handle something when they are learning, and they also need to be touched when spoken to so as to ground what is being communicated. They are highly feeling-oriented, emotional and physical, and they become bored and restless when they don't get the kind of stimulation they need. They are right brain dominant, but they tend to become a control freak. This is due to the overwhelm reaction they often experience in our predominantly visual, auditory, left brain type world. They feel alone and alien a lot of the time, and they are prone to become non-compliant because of their pronounced sense of being different. It also arises from their sense of the irrelevance of much of what goes on around them. They need caring, respectful, creative, and above all, relevant dialogue from their surrounding ecology. These are the types of people that have often been labeled indigo children, those that seem to be very gifted in some ways, very intuitive, very tuned in on the emotional level, they tend to be able to perceive when adults and other people around them are not being honest, so they'll call people out on their hypocrisy, on their false statements, and they tend to rebel against what they perceive as unjust authority or unfair systems that are operating around them. They often speak up impulsively. They may not be politically correct. They'll just say things as they see them without censoring themselves. And of course, that could make them appear to be defiant or non-compliant. Another potential pathway toward these ADD patterns is what Dr. Lincoln calls "I went that-a-way," and you could picture pointing in two different directions at the same time. In this scenario, they are flooded by normal stimulation, and they have a very difficult time discerning and discriminating among experiences, events, stimuli, and priorities. They have rather intense competence anxiety, and they fear failure and overwhelm constantly. So these are individuals who seem usually often anxious and insecure. They have a hard time handling a lot of stimulation or pressure. From the start in their life, they found they couldn't come to clarity as to what goes where, what comes first, and what is most important. It is the resultant of being subjected to significantly ambivalent and ambiguous reactions from their family. So in that scenario, they didn't really get much clear guidance, so they carry a lot of uncertainty within themselves, which is why they don't feel clear within themselves about which direction to go in. What we really need is a paradigm shift to successfully address ADD, ADHD challenges. We must make a shift from defining the symptoms as something wrong, disordered, diseased, or defective towards seeing the meaning and purpose of those patterns and using that understanding to identify empowering healing resources and environmental interventions that can help the individual and the community find greater balance and harmony. Our new understanding includes some of these ideas I'll present here. First, the understanding that these behaviors are often indicative of difficulties with self-regulation and balancing. We have children or individuals who are very reactive. They've learned a way to cope with some type of stressful situation or environment, and they've kind of gotten stuck in that coping strategy, and they've transferred it into other situations or environments where it becomes problematic or dysfunctional. So they haven't found a balance where they can address whatever situation they're in a way that best suits that particular situation. They may be overactive on one side of their brain, one hemisphere, and underactive in the other. They may be overly pushed into the fight or flight type reaction and not spending enough of their mental states in a more calm, more observant state. Another understanding is recognizing that the mind and body are an integrated feedback system. They both affect each other. And if we want to really lastingly shift our chemistry, our neurology, and things happening on the physical level, we need to address the mind, both the conscious and subconscious mind, the thoughts and the emotions. We can learn to decode this feedback rather than merely suppressing the behaviors for momentary convenience. We also can value the individual's self-healing instincts and coping skills, realizing that whatever that child or person is doing has a purpose behind it. It's how they've adapted or learned to cope with things. And rather than just trying to suppress that, we can seek to understand it and then provide skills and resources to help that person, as well as work on the environments that person is in, their family, their school environment, so to help those systems function in a more healthy way, to enable the individual to function in a more healthy way. When an individual is reacting in what appears to be a problematic, a disturbed way, that is often a sign that the social systems that they're connected to or existing within are themselves dysfunctional. Rather than just labeling and blaming the individual, we need to look at the entire system. We can start to understand how stresses and traumas can lead to reactions of hypervigilance or scattered attention. This tends to happen with an overstimulated nervous system, overstressed adrenal glands. People that are in a lot of stress and trauma, first they're kind of stuck in those coping strategies, but also their physiological system tends to get drained, so they start to get deficiencies in nutrients and neurotransmitters. So we really need to help them relax and refresh. We want to give them extra nutrition. We want to reduce some of the overstimulation in their environment, so perhaps allowing them to spend more time out in nature, taking them away from overexposure to electronic stuff. So there's different things we can do on that level. We also can recognize how lack of nurturance can lead to reactions of excessive stimulation-seeking behaviors. Learning as well how that nurturing the body, enhancing family relationships, and managing stress will help restore balance and will assist to resolve ADD, ADHD symptoms. Another understanding would be to recognize that stress is a quality of experience that can be triggered by anything that disrupts our routine or threatens the sense of balance and well-being within an individual or system. So stress is relative and subjective. Something that may be stressful for one person might not be that stressful for another person, and vice versa. We may also understand how the interaction of the individual with his or her environment shapes brain development and brain activity. Rather than thinking that our brain chemistry and our genetics are the cause of everything, we can see how the brain is neuroplastic. It's constantly shifting itself to reflect what's happening in the consciousness, in the mind, and the emotions. So we can really learn to change the brain by transforming the consciousness. Looking back upon the history of treatment for ADD and ADHD, we want to be honest and recognize that existing mainstream approaches toward addressing ADD and ADHD have provided limited benefits and many risks. the prognosis with those given the standard forms of treatment is really not that great. A majority of children who have been diagnosed with ADD and ADHD end up continuing with that diagnosis into adulthood. So with the current forms of treatment that have been dominant, those treatments aren't really in any way healing or curing ADD. They're in a way enabling people to continue functioning with the same pattern. So it's sort of helping reduce or suppress the overt symptoms, but it's not getting to the root or cause of it, and people are continuing to function with some level of challenge or impairment. Another difficulty or problem with the current approach has been that children are led to think that they are somehow defective or disordered, which can further disturb self-concept and self-worth. If these children are insecure or anxious to begin with, questioning their own competency, and then you're telling them that they have some innate or inherent problem with themselves, you may be aggravating that issue. The different drugs and medications that are used to override ADD and ADHD symptoms don't show long-term benefit. They're just providing a short-term effect, and they can actually lead to dependency and abuse. These drugs don't provide resources for the mind-body system to regulate itself, and they don't provide nutrients that support neurochemistry. If we want to provide resources on the biochemical level, we could focus on more awareness of nutrition. We could focus on particular nutritional supplements that have shown benefit for children with ADHD. We could use things like essential fatty acids, minerals like magnesium, B vitamins, some of those things that naturally are needed by the body and which we typically get in our food. What could help? To help these individuals find more balance and to help them and the people around them live in greater harmony, we can teach cultivating calmness, centered states using meditation and mindfulness. That gives people more management capability over their own mind and mental processes. We could support physical exercise, especially for those that need more physical grounding. Doing physical exercise often helps with them, and it helps address ADD symptoms. We could also provide therapies that foster relaxation and energy balancing, things such as massage and body work, which relieve the tension in the nervous system, energy healing methods, things like Reiki, craniosacral therapy, some of those approaches, different oriental types of movement arts, such as yoga, tai chi, qigong. So those are not as rigorous as some of the more Western-oriented physical exercises. They're actually focused more on self-awareness and managing and directing your energy flow. Again, nutrition can be an important aspect of helping people who are dealing with ADHD. If someone is deficient in any nutrients, or if their system is being overstressed by processed foods, things with a lot of processed sugars and artificial sweeteners, artificial colors, and so on, that could have an impact. we'll notice that some of the subtypes of ADHD are hypersensitive sorts of people, and that hypersensitivity often carries over to things in their environment, in particular to foods that they're eating. So foods that might be disturbing to them may be things that other people aren't having an issue with. So we can't assume that just because most other people aren't reacting to something that it won't affect a different person. Detoxification may be important. If those individuals have any difficulty with some of those environmental hazards, it might be accumulating in their body and creating some type of disruption or interference. Heavy metal elements are one common toxin that could affect the nervous system. That includes aluminum, mercury, cadmium, and those are becoming more and more abundant in our environment in the modern era. So that's something that could be addressed on the biochemical level, helping clear out, detoxifying those particular hazards. Family counseling and family bonding. Again, if you have a stressful family environment, that could foster ADD, whereas promoting more harmony, more respect, more positive interactions could help alleviate those ADD issues. Neurofeedback is a method of training a person to learn to manage their own brain activity. So those brain balancing methods have often been found to be helpful. Energy psychology is a way of connecting the body with the mind through energetic methods, things like tapping on meridian points, placing hands on different positions on the body, connecting to the two brain hemispheres. All of those things are designed to help integrate shifts in our consciousness, in our subconscious systems. Nurturing creativity. Everyone is creative, and if we can support people's creativity, enabling them to engage in activities that actually interest them, that motivate and inspire them, then they'll function better. Light and sound therapies are another very helpful resource. Relaxation and stress management, which overlaps with a number of these other approaches. Reducing EMF overload, working on grounding. EMFs stands for electromagnetic fields, and our modern environment, of course, is flooded with electromagnetic frequencies. Children who have these ADD, ADHD types of issues, and also those on the autistic spectrum, tend to be extra sensitive to those electromagnetic fields. And to help them, we want to work on grounding, connecting them to the earth, helping them be more stable and centered so that they can actually handle those energies without being overwhelmed by them, without being thrown off balance by them. Spending time outdoors in nature is often beneficial, and that in itself tends to be grounding. To kind of summarize and review here, those labeled with ADD and ADHD are coping with anxiety, insecurity, overwhelm, stress, and/or alienation. Prescribing synthetic drugs and telling them that there's something wrong with their body or their behavior can often be counterproductive. A holistic healing approach based upon a deeper understanding of these patterns brings an opportunity for promoting health, balance, and wholeness. For those that really want to learn more about this, including finding different books and articles and scientific research and literature that explains this from many different angles, I encourage you to visit my website, phinsights.com, and there's a page there, links.html, which covers information on many different topics in holistic healing. And there's also a specially devoted page for ADHD, adhd.html, which focuses specifically on this subject area. I appreciate each of you for taking your time to educate yourself about this subject. Again, I appreciate having the opportunity to share this information. There are many different resources, different books, articles, many people out there who are providing valuable resources. So I commend those who are contributing to this knowledge base and contributing toward helping people and those around them address ADHD. I'd like to wish everyone a wonderful day. Namaste.